Good evening, everyone. If we could take our seats, we'll begin shortly. Good evening and welcome to everyone here tonight. Thank you all for joining us as we continue the important work of the Massey Commission. I'm Jerry Cruz. I'm the presiding co-chair tonight. I see that we have a quorum. The quorum is established, and I'll call the meeting to order. First order of business is to approve the minutes of the previous meeting. You have the minutes in your packet. Are there any additions or corrections to the minutes? If not, is there a motion to approve?
So moved.
Susan moves, and second? Second by Sunshine. All in favor, aye.
Aye.
Opposed, nay. Also, we will have a public comment period tonight. All those who wish to make a public comment, please sign in at the desk to my left here. And now it's time for our work group reports. The work groups have really gained a big head of steam lately and are really moving forward on a lot of important topics. And I'll ask for each a member of each group to give an update. First, Sunshine Clemens, Law Enforcement, Hiring, Training, Wellness, and Cultural Competence.
Thank you. Happy Pride Month, everyone. We, at our last meeting, had a presentation from Eletsby. Sherilyn Williams came. We also heard from one of our work group members on the science of hope and potential ways that we can incorporate that into various police training or presentations. And we will have Sheriff Crouch at our next upcoming meeting, which will be on July the 7th at 5:30. The location is to be determined because there are some acoustic issues at our current place, so we're looking for a different venue so that there's better sound for everyone. So that will be updated on like our social media, and it'll be on the release. But at this point, I can't say, but it will be July the 7th at 5:30, and we hope that you all can attend that.
Thank you very much. Now, Brian Wojcicki from the Integrated Mental Health Services and Emergency Response Work Group.
Last month, we had county court probation services present to us. We're getting down to the end of things, so we're going to try to squeeze in youth mental health focus, school education systems. We'll see about the availability of Board of Education and District 186, but at least we'll be getting the material to make sure we put it into the work. Don't have a date yet. That'll be dependent, obviously, on our guests.
Hey, Brian, what did you say about the Board of Education?
So I've reached out to the Board of Education and District 186, and that's
okay.
One way or the other we'll be getting
great
information.
That's good. Thank you. Vanessa Nelson-Knox for Community Education, Public Health, and Safety.
Yes, our Community Education, Public Health, and Safety Work Group met on Monday, June 9th, to plan upcoming healing events in recognition of the anniversary of Sonia Massey's death, as well as to advance a resolution calling for a visible symbol of accountability on the county building. Please find both the event plan below and the resolution attached for your review. July community healing events. In addition of the anniversary of Sonia Massey's death, the work group recommends the following events and community actions throughout the month of July. To wear purple. Community members are encouraged to wear purple throughout July, especially on July 6th, as a sign of solidarity, remembrance, and support. To plant a purple flower as a simple act of remembrance. Individuals are invited to plant a purple flower at their home or in their yard. Healing circles will be hosted throughout the community, including by Thrive Center for Wellness and SIU Memorial. Under community events, we have July 10th, 11 amp concert, to be confirmed exactly what time, a concert dedicated to Sonia Massey. Additional events, the work group is actively exploring our opportunities for community-centered healing and remembrance. Our next, the working group also believes that a permanent physical symbol on the county building is essential to promote healing, remembrance, and a commitment to systemic reform. There's a resolution outlined in this proposal for consideration by the commission chairs, the Massey family, and the commission as a whole. Our next upcoming meeting will be June 28th at 2 o'clock at CAP 1908.
We're in the midst of doing the work on that proclamation, so thank you very much. Next, Veronica Espina, Economic Disparities and Service Accessibility.
So we met last June 2nd, and the meeting examined economic disparities in relation to business growth, funding for Black businesses, and access to funding for Black and Brown-led and owned nonprofit organizations that work to improve infrastructure and services for impoverished neighborhoods in Springfield, particularly on the east side. We had the Springfield Sangamon Growth Alliance, Mr. Ryan McCready presenting. And part of our, contentious discussion focused on the fact that the organization doesn't utilize a lens that incorporates systemic, institutional, and structural racism as part of the business analysis on how and where Springfield needs to promote equitable growth. And because of this, the Sangamon Springfield Growth Alliance lacks representation of minoritized and marginalized businesses in its board, in its business meetings, and attendance to conferences. So we talk about improving this and what are the needs of the most impoverished communities in Springfield when it comes to funding. For the next meeting, we talk about some of the things that our work group is finding out to be presented at City Council as well, because there is a contentious discussion at City Council on resources for Black and Brown-owned businesses and non-for-profits. And we have a pending discussion on food insecurity for the upcoming meetings in July.
Thank you, and thanks to all of the work groups for the great work that you're doing, and we look forward to your recommendations that will come to the Commission for action. So thank you so much. Tonight, we've invited two groups to present information to the Commission. First, we have Recovery-Oriented Systems of Care, or ROSC, a community-based framework that emphasizes long-term, person-centered recovery from substance use disorders. ROSC focuses on coordination, collaboration, and sustained support, helping individuals reconnect with their communities, families, and services. Commissioners, you have the biographies in your packet, and I'll share you a little bit from those biographies. Joining us tonight from ROSC are Whitney Devine and Austin Dambacher to share with us how their network meets to plan, design, manage, and advocate for recovery supportive strategies tailored to local needs. Whitney Devine brings over a decade of experience in healthcare and a deep personal commitment to recovery with 6.5 years of lived experience. She began her journey as a peer recovery specialist and earned her Certified Recovery Support Specialist, CRSS credential. Now serving as the ROSC Program Manager for Sangamon County, Whitney has helped the program grow significantly. She's a passionate advocate for person-centered care and believes connection, support, and community are essential to lasting recovery. Austin Dambacher is the ROSC coordinator with over 7 years of lived recovery experience and more than 4 years in substance use treatment field. Before taking on this role in January, he worked as case manager at a 90-day treatment program. A certified peer recovery specialist and a University of Illinois Chicago graduate with dual bachelor's degrees, Austin is a Springfield native, passionate about community-based recovery and system-level care. Whitney and Austin, thank you for joining us and giving your time to the Massey Commission. The floor is now yours.
Hello, everyone. First, I want to say thank you for giving us this opportunity to come out here tonight and to present a little bit about ROSC to you all and some of the findings that we have found in our community survey. So we just want to take that time to thank you. And my name is Whitney Devine. As they said, I am the program manager for Sangamon County ROSC. And this is Austin. He's the ROSC coordinator. That's it, yes. He's the ROSC coordinator. So ROSC stands for Recovery-Oriented Systems of Care. And what ROSC is it's a state-funded program operating in most counties across Illinois. So we represent the Sangamon County. And ROSCs are responsible for providing coordination, access to information, information sharing. They help conduct community assessments and help improve recovery infrastructure in the community. Another part of what we do is we hold events for people in recovery, whether that be substance use disorder and or mental health. And then we, for our events, we open those up to the entire family as well. We do not provide direct services. However, Sangamon County ROSC, the recipient of that grant, is Family Guidance Centers in Springfield. And so they're kind of like our host, if you will, and Family Guidance Centers provides all kinds of recovery services, whether that's inpatient, outpatient, Medicaid-assisted recovery, et cetera. And we also, let's see, the state requires that each ROSC conduct a community assessment measuring awareness of recovery, resources, and barriers to access. So that's one of the deliverables that we do throughout the year is we try to measure care in our communities. And in our ROSC Council, we try to have as many voices at the table as possible. So we invite people to join our monthly meetings because recovery is for everyone. You know, substance use issues and mental health conditions, they do not discriminate, and recovery shouldn't either. So we try to bring as many people on board to try to reduce stigma in our communities. Here's a snapshot of some of the people that we have a part of our council now. We meet monthly and just discuss what are the gaps in care and, you know, how can we better serve people in our communities when it comes to substance use and mental health disorders. And then what can ROSC do for you? A big thing that we try to do is awareness. So we know that there are resources in our community, but there seems to be a lot of lack of awareness when it comes to those resources. Maybe some of you in here maybe never even heard of Sangamon County ROSC, you know, and so that's what we're trying to do is just make information available to everybody. And this, you know, some of the things that we've done are community resource guides. So we have taken existing resources that we know exist, and we've developed them into really comprehensive resource guides. We have both a digital version, so people can access it online, but we also know that not everybody has access to internet. So we have developed booklets as well. We've placed them with the commissioners. Those booklets are very extensive, anything from, you know, recovery-related resources, but anything that might be helpful to people in the in the community. So whether that be spirituality, where your local parks are, food resources, anything, we've tried to cover it all. And then we've also developed an online resource map, which is a Google map that people can visit as well, and it will show you exactly where to find different resources in the community. And the other thing that I touched on were our events. Our events are for everyone. One of the things we try to stress is that recovery doesn't have to be boring. As someone who is in recovery themselves, you know, when I started my journey, one of my biggest fears was going into recovery that I'd be alone and that I wouldn't have connection, you know. And so when we put these events on, we try to create a safe space for people to get together and to get to know other people in recovery, just to help, you know, build their supports, but also to help them explore activities, hobbies, coping stuff. Just things that they can do in recovery that are fun. Our events are always free, recovery-oriented. all-inclusive. We try to invite the entire family so people can bring their kids, their spouses, their loved ones. And then our events are all sponsored by local organizations and businesses. So we've been very fortunate to have local businesses help support our events, whether that be donations of food. We even did like a music bingo event and context. The gentleman laying down there, we were playing a game of charades. And so, as you can see, our events have all kinds of things going on. We did a Let's Talk About Recovery event. That was a taco event, and we had speakers share their personal stories, whether that be from substance use disorder and/or mental health. We also try to attend outside community events. We were at Springfield Pride Fest. We're also planning on attending the celebration in the park in August. We're just trying to get ourselves out there and get ourselves known. We also did Relax and Recover, which was a tie-dye event, and that was really cool. We had people register and come out, but we were situated in a park, so we got to a point where we just told everyone in the park to just come on out to our event, so that was really cool. And this is our next event. It's a water balloon picnic. It's going to be out at near Kiwanis Park, 2924 Stanton Street, and that's open to the public. We'll have food. All ages are welcome. Again, it's just an opportunity for people to get together in a safe spot. Another thing that we try to do at our events they are free, but we encourage people that come to our events to bring donations of basic household items for individuals starting out in sober living homes. We know that a lot of people that are leaving treatment are just getting on their feet and they don't have a lot, and so we try to collect things like basic hygiene items, even new bedding, towels, just things to try to help them as they're starting out. And so we've got a bit of a surplus right now of items. Some individuals at Gateway, they've been contacting us, and we've been just making hygiene kits as needed as people are leaving treatment. So that's been cool to see, and people getting involved with that. And now I'm going to turn it over to Austin, who is going to talk about our community survey.
Correct. So as Whitney introduced me earlier, my name is Austin Dambacher. I'm the Ross coordinator. So this is really why we're here, and my biggest gratitude to the commission for having us tonight. Grateful to be here. Her and I, before, we were like, how did we get here? We're like bigger than ourselves now. And it's a fantastic thing. It just goes to show what the community, can do when we all come together. So so IDHS Super, our fund source, they require that we do a community survey. This was the very first one that they had us do. They'll likely have us do it again. We will likely make a lot of changes to how it's done, where it's done. So the dates that we did the survey were from the beginning of December of 24 to towards the end of February of 25. Again, we're Sangamon County ROSC, so our target area was solely this county. There are quite a few other ROSCs throughout Illinois. Counties with bigger cities, bigger towns in them generally have their own ROSC. Smaller counties that are more rural, more often than not, they'll combine a few counties together to make their own. So we had our survey online via SurveyMonkey, and then we had paper copies that we distributed throughout the community to healthcare organizations, law enforcement agencies, public, private schools, businesses, anyone that was willing to take the time to do them. We tried, because we wanted to get the best snapshot of the county's perception of recovery resources, the gaps, Another part of the focus group in addition, or another part of the survey in addition to that first part was that we do 2 focus groups, which we completed. So one of them had 9 participants comprised of people experiencing homelessness and substance use needs or substance use disorder. And then the second focus group had 8 participants comprised of people identifying as being in recovery and residing in a sober living home. Interestingly, we got essentially the same answers across the board between 2 very different populations. So, you know, myself being in recovery, Whitney being in recovery, her and I in the back of our minds, we already kind of had a very good idea of what gaps we're going to show. But then the more data we collected with the focus groups, with the surveys, the more it just kind of reassured us and also put it on paper that was submitted to the state, you know, on it. So now, not only is like not only were our beliefs like confirmed, but like now it went to a state level. So it's very much in their hands. So we're not going to go through all the survey questions because we don't have the time. The survey included 26 questions on substance use, mental health resources in the county, barriers to access, strengths, weaknesses, you name it, it was in there. We do have our full survey, our full needs assessment on the website, sangamoncorosc.org if you're interested. 10 of the questions were required, provided to us by IDHS Super. The others we came up with. Oh yeah, to dig a little deeper, because some of the questions that they gave us, if you go look at the survey, I'm not saying that the state provided the first 10 questions, but I'm not saying that. Some of them were incredibly vague. We wanted to know more. So, you know, we came up with the extra questions just to try to get, you know, a better picture. So our target response audience was 300 people and 2 focus groups. We got to 243 with 2 focus groups. Some things to note and to keep in mind during the next few slides is the survey responses reflect underrepresentation of people under the age of 24 and over 65. And all of this data is comparative to the last census that was done specifically for the county. Let's see, underrepresentation of males, underrepresentation of Asian and Alaska Native American Indian respondents, and then an overrepresentation of people in recovery from either substance use disorder and or mental health conditions. So these are just going to be some of the demographics. All of our demographic questions were optional. In the paper surveys, there were quite a few folks that, you know, they might have filled out the age, but then didn't fill out another one. So I personally think that's why they're all over the place, but who knows? So more the Caucasian and white and then Black or African American respondents as far as race goes was fairly proportional to what the census was, but in those other areas you can definitely see that there are gaps.
Excuse me, question.
Yes.
2 questions right off the bat. When you say we wrote the other 16 questions, is the we the 2 of you, or is there a group, or?
So I'm going to hand this one to Whitney because she was involved. I came in after, like, mid-survey, so she will know more about that than I will.
Hi. So the questions were developed by myself as well as the other council members, so people that are part of the Sangamon County Ross Council. So some of those organizations that we represented earlier are some of the people that were at our meetings and helped us come up with the questions. We had the ones from the state, and then we wanted to look at it deeper, more in depth, I guess.
Yeah. I just didn't know who the "we" was, so thanks
right.
for that. And then secondly, are these results available online? Because I can't read this.
Yes,
I mean,
they
this
are.
is-
So those results can be found on our website, which is on our resource guide. You can scan the QR code, or it's also listed, I believe, sangamoncorosc.org. We have a tab on there for our strategic plan, and it highlights, the questions that were asked and also all of the results.
Okay, so we are going to go to some high-level findings. What now? Yes.
There you go.
There we go. Okay, scared me. Okay, so I don't think anyone's surprised. Respondents were aware of the fewest resources and services for youth compared to adult services. In general, awareness of mental health related services was lower than the awareness of substance use related services. So that's going to be your inpatient, outpatient, mental health treatment, sites compared to the substance use treatment providers. So that's the big one with that. And then in a few slides, we have a gaps analysis that really shows where those numbers drop off. This next one, nearly a third of respondents were unaware of any resources for peer support services. Next year, when we do this survey, I think we'll probably reword it differently because not many people know exactly what a peer support service is. So there's three major gaps that we identified throughout the survey. There's youth, family, and then individuals either incarcerated or leaving incarceration. This next one, nearly half of respondents were unaware of resources for people exiting incarceration with substance use needs. And a majority, so 62%, which is not a small number in this survey, were unaware of any resources for this population that related to mental health. Later, we found that's because there are none. So that number, made sense. So these are all of our barriers that we've found. So those top 4 or 5, wait lists, inability to pay, the stigma, lack of insurance, and then transportation. The rest, are absolutely barriers too. If they weren't barriers, there would be zeros next to them. And in our focus groups, in our open-ended questions, all of them came up frequently, but specifically those top 5. Okay, so this one, I was so pleasantly surprised and happy and proud of Sangamon County on this. So it turns out a lot of people in Sangamon County know what naloxone or Narcan is. They know how to use it. They know where to get it at no cost. And that was, like a lot of the other results that we got, that was pretty consistent across the board, whether it be focus groups, whether it be the survey, whether it just be in, random meetings or interactions that we have with members of the community. I still think there's a long way to go, but, compared to the numbers from other counties, I feel like we're in a pretty good spot. Okay, this is the gaps analysis. I know you can probably hardly read that, so there's only a handful of things that I want to touch on. So our very left column up top, where it says the legend, those are going to be our high level of awareness, and then high amount of resources. So 1, 2, 3, and 4, that will be your support groups for people in recovery from substance use. So a lot of 12-step programs in the county. That will be recovery housing, so sober living, transitional living, supported living. And then we have adult outpatient substance use disorder treatment, and then 4 is harm reduction. So as you can see, it kind of takes a nosedive. So number 7 and number 10, and I really hope that you guys like get these slides after so you can zoom in to read this. So those are going to be for mental health treatment, whether it's inpatient or outpatient for adults. So those are going to be, you know, getting lower on that graph if we're moving from right to left. That's because there's not a lot of awareness. There's some awareness of them, but there's only a few resources. So those few resources that do exist must be doing a pretty good job if, you know, they're not completely at the bottom of that graph as far as, you know, making their services known to the community. And then, so the further right we move on the graph, or the further right that we move on the legend, and the further left we move on the graph, that's going to be very low awareness of resources and very low amount of resources. So that will be behavioral health crisis response services, youth outpatient mental health treatment, youth inpatient mental health treatment, support groups for people with a mental health condition, and then our final column on the right is going to be support groups for family members of people with a mental health condition, and then mental health supports for people who are incarcerated or leaving incarceration. So again, it's one of those things where I'm a very visual person. I like tangibility. So whenever everything was mapped out like this, I was like, okay, now I get just how drastic it is, you know? So compared to, you know, adults have more chances than the youth do, but then even then if we go back to those barriers, then, you know, it just goes from there. So there, you know, there are gaps, there are silos, and inconsistencies, you know. So these were the 3 main areas that I referenced earlier. So youth services, people under the age of 18, there's little to no services. Outpatient substance use treatment, there's 1 site for adolescents compared to 18 for adults. Inpatient mental health treatment, there is 1 site, and then adolescent residential, so your typical like 28-day stay substance use disorder treatment, 0 providers in the county. Support groups, so those are going to be your you know, Alcoholics Anonymous, Narcotics Anonymous, Al-Anon. There's a lot in Springfield, but there's a lot in Springfield for folks who are specifically in recovery. And then if we want to break that down further, there's a lot more for people in recovery from a substance use disorder than there are people with a mental health condition. And then the families, you know, the amount of resources that we have, it's pretty much good luck, which, you know, it can change compared to where it was 7+ years ago, whenever I came back down here and, you know, started my journey. That's more than what we had back then. So we're getting there extremely slowly. And then that last one is services related to incarceration. So Sangamon County Jail serves many people with substance use disorder and/or mental health needs, but the awareness and existence of resources related to supporting people currently incarcerated or exiting incarceration is low. I do know of a few that kind of spring up and then fizzle out, every other year or so. But compared to other populations, the services essentially aren't there. So, if anyone has questions, now would be the time.
Is this the end of your presentation for both
Yeah.
of you? Yeah,
Yes.
okay. So this is the time for questions and comments. So, commissioners, yes, Brian?
I had a few to kind of build on. You had mentioned, actually, it was a couple slides ago about the incarceration and exiting. Is the county, in particular, problem-solving court and probation services, are they part of the monthly meetings with you guys?
So we have had representation from the Sangamon County Sheriff's Office, but it hasn't gone much deeper than that.
Okay. Yeah, and whatever we can do to help with that, because that's, so they presented to us last month or a few weeks ago. These months are running together. The one thing they did comment on is they obviously only have so many resources, but that continuity of care, they can focus on the 50 or so that they kind of have to max out at, but so there's interest, and I wish they were obviously more involved, but whatever we can do to help with that. But
Absolutely, and one of the things that we've been in talks of developing are resource bundles for people that are leaving incarceration. Whether it be getting them our resource guides that we've developed, but also things that are more specific to leaving incarceration. That's one thing that we're working on too within our Ross Council, is developing, what do people need, whether that be job resources, housing resources, just information on that, and even just like basic supplies as they leave incarceration.
so I had just two more. The chart you had about the comparison, so obviously the more we had, the more that was being utilized. Compared to each other, I get that comparison, and obviously levels that are at 0 and 1, that's inadequate. Do we have anything, or is there any plans, whispers from DHS about understanding what adequacy levels look like?
So, DHS, so every county that has a ROSC, which I believe there's 40 some ROSC councils throughout the state of Illinois. So all of us we all submitted the exact same, data from the questions that they provided, but also from our own questions. I know that at our statewide conference back in April, they had been combing through it. They're hoping to get like a good picture of where the state's at, and then, if we do this annually, then we'll be able to gauge some measure of progress, hopefully. But as far as what what the standards are, there hasn't been anything established yet. I'm hopeful that there will be, though. But since this was their very first time doing it, they told us very plainly that this was a huge learning experience for them. So I'm hopeful that we'll move in the right direction as far as establishing, like what's acceptable, what needs to be done better, what's being done, well, so that all of the ROSCs and then all of their, the council members, we can act accordingly.
And then my last one was more of a kudos than anything. So mental health work group had been pretty clearly going to be working on recommendations towards a resource portal. And before I bumped into you guys at that 708 commission meeting, I'll just share, even DHS's own search, Beacon, DCFS, the county, the city, you guys easily have the best resource guide in our area.
Thanks. Sunshine?
Thank you for your presentation. It was a lot of good information. I know you all talked a lot about like gaps and things that you see and notice And this commission, at the end of our year, we're supposed to be putting forth a report of recommendations. So with you all being the experts, my question is, from your perspective, what would you like to see us making a recommendation on to help you all with that? And I know the answer is everything. Like, before you even answer, I get that. But if you could maybe boil it down to like your biggest need, or like what's gonna be the most impactful from your perspective, that would help.
Well, you know, one of the biggest gaps that we saw were in youth. So I would say that is a big thing, you know, starting with the youth, and whether that be preventative measures, but also just education even on mental health and substance use related issues, and then just providing more support groups and things like that, because I have not seen a lot of support groups for youth, and it's helpful to have support groups, especially when you're among your peers. I think when you're struggling with something, to have support groups with people that are also going through the same thing. So whether that's something that's developed in schools, you know, peer support for kiddos, that kind of thing. That's my personal thought.
Conversations like these, because this is what gets the ball rolling. There's Springfield, Sangamon County, there are a lot of good resources here, and a lot of good agencies with a lot, and I mean a lot of good people in them, that are, you know, genuinely empathetic, who want to make a difference, who want to do good, who want to help people. So I love things like this where people come together, you know, for the good of the community, because Springfield's a good place. Is there room for improvement? Yes. Yes, there is. But, you know, I think conversations like these are how we get things done. And, you know, there's strength in numbers. And the wild thing to me is that Springfield has, you know, some large healthcare providers, treatment providers, stuff like that. I genuinely think if there was better communication in between agencies, not even, you know, it wouldn't even have to be treatment providers or hospitals or doctors, but I mean like everyone, then I think a lot more stuff could get done. And I think that we could, you know, make progress a little bit quicker than what we are currently.
Whitney, to your point, you said the gap is really with the youth. And more peer support groups, more education for that demographic. Who would lead those groups? So if we were to draft a recommendation that that's what's lacking in this county, in this area, what type of credentialed person would you be looking for to lead those types of groups?
You have thoughts on that? I do. Okay.
Okay, so the youth thing is tricky. Having worked at a you know, treatment facility, everything changes, whether it be from Joint Commission, from IDHS Super, if they're under 18. And it is a lot more responsibility to take on with staffing, with finances, especially with curriculum too. So if someone like that, you know, would start a group, I think it would have to be a already well-established organization within the community.
Okay. Yeah, can you name one?
Yeah, NAMI, Memorial Behavioral Health,
Okay.
SIU Springfield Clinic, you know, ones
Okay.
that already have, you know, maybe not the time of day, there's never enough time in the day, but ones who already have staff, or, you know,
Curriculum, all
curriculum
of that.
departments specifically for, you know, youth, because especially with substance use recovery and mental health, recovery, it's so much different for youth. And I know some young people that are doing it, and I have nothing but the utmost respect for them, because I was not doing what they were doing, and I can't even imagine doing it in today's world. And like there's a lot of cards stacked against them. So I think that a big provider providing, a neutral place where they could meet with someone who is well qualified to kind of lead the discussion, I think that's who would be able to do it and do it well.
I have a question. Yeah.
Vanessa?
Are any of you on the board with Rosecrans, since they took a lot of the kids from here? Gateway didn't serve them anymore, and they all had to go to Rosecrans, which the closest one is in Champaign. So are any of you on the board with that? And the other, I guess, comment would be for the reentry community, without having the substance use help and mental health help, it's truly a setup to fail. It just won't work without that. And there's a lot of evidence to show that. All of us that have worked with them for many years, we know that. So have you heard of any of the organizations such as Rosecrans? Are they going to have more buildings? Are they going to stretch throughout the state? Because to drive 2 hours away and 4 hours away to see your little kid that is suffering like that. And they've also said for quite a few years that they're going to have a huge methadone clinic around Central Illinois. We haven't seen it yet. So those are the three that I have questions on.
Okay, so I'll do question one, and then she can do the rest. So we're not on the board for Rosecrans. A few reasons. One, since we don't do direct services, so yes, we're technically under Family Guidance Center, but they kind of just give us a building to use, and they're the ones that get the grant from the state for us. Also, though, they're outside of the county, so everything that we do has to be specific to Sangamon County. I wish that they would expand, because they are one of the precious few places outside of Chicagoland that accepts youth. And I just hope one day that they will expand.
As far as the other question goes, I know that Family Guidance Center, that's the recipient of our grant, they are already in the county jail. So they deliver medication to people that need medicated assisted recovery, so they're not experiencing withdrawal in jail. So I know that's already a thing, and then we also work to try to get those individuals into treatment, and we work with, even Family Guidance even works with like Christian County and surrounding jails to identify individuals that would benefit from substance use treatment. And so many times those people will come directly from the jails to Family Guidance inpatient treatment. I can say that. And then, what was the other question you said?
Methadone clinic.
Okay, so I am not sure, I'm not familiar with a big methadone clinic, but I can say that Family Guidance Center does have a methadone clinic as well. We also have, we offer Vivitrol and Suboxone as well. And then Family Guidance Center also has a medicated assisted recovery van. It's a mobile unit that goes from location to location to try to identify people that are in need of those services. They go to places like the Phoenix Center, Washington Street Mission, and then they even go to surrounding counties as well. So I know that they go to the Locust Street Resource Center in Carlinville, Jacksonville, some of the surrounding areas. And with them, they're just constantly expanding out more and more. And they're also moving into some harm reduction initiatives too, so they always have Narcan available and things like that as well.
Okay, I've got a couple of follow-up questions. So You two are certified recovery support specialists and certified peer recovery specialists. The SIU Medicine has noticed the importance of those roles, that there is an increase in number being produced now. Where are we on that level? Is that a recommendation about the exact things you do? What's your feeling about the supply?
Do you mean, like, do you think we have enough of
Are
that?
enough being trained?
I wish it was more common across the board,
Yeah.
if that makes sense. We have peer roles, sprinkled throughout organizations, but I do wish that it was more centralized. So even within like the health systems, people working at the hospitals, so if they encounter individuals that are struggling with mental health or substance abuse, they can call, I don't know, a call system or where they can get a peer to come and talk to those people as needed. I wish it was more like that.
Yeah,
But
so more integrated into the systems that we have.
Yes.
Okay.
Yes, and schools. I would love to see it in schools and just anywhere where those needs are identified. Even in law enforcement would be great. If law enforcement, I know there's like mobile crisis response team, and many of those individuals are peers. And so that is great, and I think the more that we can do that, the better, because the people who've lived through it have a unique sense of compassion if they've lived through it themselves, and they can also speak to people about how they got through it.
Right. So medical-assisted therapy, medical-assisted recovery, medication-assisted therapy and recovery. I know you've said there's a gap for incarcerated individuals and adolescents, but in general, then for adults, the number of those programs in this county, you just have a quick general feeling about the adequacy of that?
So, like I said, we are working, with law enforcement as far as medicated assisted recovery. Family Guidance Center is. But I would say that there needs to be more youth mental health services, just in general. That's the big one.
So, yes, I mean, I think we could say that across the United States, as a matter of fact. And you clearly pointed out in your survey exactly what we've been focusing on about mental health services and coordination across the county. But just one more quick question from me. So we've been noticing the various gaps. And so is there a gender gap in treatment? While you think about that, I'm also going to say for treatment of those in the helping professions, emergency responders, police, race. Did you have any data on that from your survey or any feelings?
I would say not from the survey particularly, but I know that as far as like, I'm thinking LGBTQ plus, I know that like the Phoenix Center offers some good support for that community as far as mental health and substance abuse, but on an inpatient level, I know that that's, our treatment centers, we accept everybody, anybody, Family Guidance Center, anybody that, regardless of income, regardless of level of care, we try to accept everyone, even if we have to send them, to detox first and then bring them back to us. We just try to help everyone.
Oh, I understand you do. I'm just talking about community gaps, not,
right.
not your own gaps.
As far as the community goes, I think we could always use more, right?
Any other questions, Susan?
Maybe a partial answer to your question, Dr. Cruz. My understanding is that there is a significant lack of providers of color for mental health across a variety of fields.
Correct.
Here and elsewhere. So that may be part of the answer.
I think, yeah, go ahead.
Go ahead.
No, if you're not finished, yeah.
So my question is about one particular category that you mentioned, and it was sober living houses. And I'm curious how you define that and if there are qualifications for it, because the two that I'm aware of had no staffing by anyone who had any expertise or credentials. So I would not recommend someone in recovery live there.
Okay, yeah, I understand that point of view. The people that do live there are people that are in recovery themselves. Many of them have worked their way up, you know, whether they started living there, started their recovery journey there, and then they have gotten involved in service. So I know some of the recovery homes around here, Oxford Inc., and then there's many others. I know with Oxford Inc. in particular, all of those individuals are in recovery themselves, and they have many requirements in order to stay at these recovery homes, so it's not just this like free-for-all. And then many of them too, when we did our focus group there, everyone in the house was required to be trained in knowing how to use naloxone. So I don't know I can't speak on their exact expertise, but I can say that it is a lot of the peer level that we're talking about.
So I guess I still have a question about definition, because I'm not sure the ones I'm aware of would be on your list. Like I'm not sure the ones I know of are legit. So is there a definition? Is there a certification process? Is there a way that someone becomes the facilitator or owner or director of a sober living house, or is is there any regulation or guidance, or?
There are privately owned sober living homes, and then there are those that are under Oxford Inc. And Oxford Inc. is not unique to just Sangamon County. There's Oxford houses, you know, across the state. So as far as sober living goes, our focus group was, you know, a local sober living home here that is owned by one of those larger facilities. But I guess, like, for what purposes the sober living are you wanting it defined for?
I guess what would be helpful for me is when, so I work at 7th and Capitol. I have regular conversations with people who have any combination of substance abuse experience or mental health or illness, and often are looking for places to live. And if I had some assurance that a place was adequately staffed, that they had some sort of trained and certified persons there, as opposed to the ones I know of where there's nothing, then I would have somewhere to refer people. Right. And I don't know that being part of a corporation that has places all over is what I'm looking for either.
Right.
So as far as sober living goes with you know, individuals who have some certification or another licensure, like the more of a structure, Sangamon County does not have any that are specifically like that. So I think with our definition of sober living, it's on very good faith that the structure is more or less individuals in recovery. I know a lot of them require people to come there straight from treatment, whether it's residential, whether it's a long-term program. A lot of them do require tox screens, breathalyzers, random searches, stuff like that. But as far as there being, like, you know, staffing or anything like that, it's more or less a group conscious. They might have a house manager, that, oversees things. They might have someone in charge of finances specific to the house or the district. But in terms of like a structured, certified, IDHS super supported sober living home goes, Sangamon doesn't have any of those yet.
And last question, did you by chance bring any more of your resource?
Oh yeah, we have a whole box of resource guides and brochures, so if anyone else
Thank you.
wants them, we'll be here.
Well, thank you for the work you do, and thank you for the presentation tonight. And if you think of any other action we should take and a recommendation you'd want to make to us, get it to us. So we'll, thank you. Yeah, thanks so much. So also with us tonight are two experts who will share the ACLU traffic report. I'll introduce them shortly. You've got the biographies all in your commission packets. We appreciate the expertise we're going to see tonight, and we'll introduce Ken Page and Ed Yohnka, who will be offering insight and analysis to the reports to share with us. So you can come on up and take these seats. Ken Page retired after 38 years with the state of Illinois, spending 25 years as director of the Office of Environmental Justice at the Illinois EPA. Originally from Selma, Alabama, he earned his undergraduate degree at the University of Alabama and later moved to Springfield and attended Sangamon State University, now of course UIS. Ken is a former president of the Springfield NAACP, currently serves as president of the Springfield chapter of the ACLU of Illinois. He's also a Prince Hall Mason and a life member of both the NAACP and Alpha Phi Alpha Fraternity Incorporated. Edwin Yohnka is the Director of Communications and Public Policy for the ACLU of Illinois, where he has served as a spokesperson since 1999. He regularly appears in media and is widely cited on civil rights and legislative issues. He also leads the ACLU's communication efforts across media platforms. In 2013, he served as vice chair of the Illinois Unites for Marriage, helping secure marriage equality in the state. Before joining the ACLU, he worked for the American Bar Association and supported its national leadership. Thank you both for so much for being here, and you have the floor now.
Good evening.
Good evening.
Thank you for allowing us to speak to you this evening. Again, my name is Ken Page. This is Ed Yohnka. And our discussion this evening is going to center around, for decades, black and brown communities in this country had voiced the concern about being over-policed and stopped by police quite often. And it was and it will be in the slide presentation, and hopefully you can get this slide presentation from the Massey Commission, I don't know, or it may be on their website. If not, we will make it available.
We'll get it to you.
Okay, I didn't want to put Ed on the spot, but we'll make it available to you online. I'm not going to print it up for you. But in 2003, State Senator Barack Obama put forth legislation to collect traffic stop data. And during that time, it was my tenure as the NAACP, Springfield branch NAACP president. And what was really interesting, when that data came back, we met with the police department in their offices, and a professor from Western Illinois University spent the entire time discussing that data and discussing to us as black people why what we were seeing was not what we were actually seeing. So, and you know how that went.
Yeah.
And he really did that. It was like, when we saw it, we were like, oh, so it shows it. But then he was trying to explain to us why what we were seeing was not what we were actually seeing. And this is not our first time at the table. This is our first time at the table with the Massey Commission. And we do appreciate it. We've met with Springfield Police Department, the current police chief, not in his capacity as chief, but the past chief and the chief before that, and regarding this data. And the ACLU has always been active in this, looking at this data. And in 2019, 2018, it was set to sunset and no longer collected, so the ACLU pushed that out, and we were very happy that we did. So now that data is going to be collected indefinitely. It would never sunset on the collection of the data. The data is extremely important when you look at it, and the relationship that black and brown communities have with police and policing. and those simple things as a traffic stop. So I'm going to get into the slideshow presentation, and I'm going to pass some of it off to Ed. I think this little thing, I was going through withdrawal from my remote at home, but I got one right here, so cool. I'm good right now. But traffic stops. The purpose of traffic stops is to promote road safety and keep drivers and pedestrians safe on and along our roadways and streets. The breadth of reasons for a traffic stop: speeding, equipment violations, you're familiar with those, failure to use a turn signal, to cross a lane, etc., making a rolling stop at a stop sign. And police have broad latitude for traffic stops. And I kind of threw that in there about a rolling stop. I mean, some of us are familiar in the black community. There was a rap song about that. Making a rolling stop. You know what that meant is you didn't stop at the stop sign, which nobody in Springfield stops at a stop sign. Nobody in Springfield stops at a stoplight. No, in any ward. So I want to put that out there. So, oh, Ed, will you do me that pleasure, please? Okay. Now, you know these simple stops for minor traffic violations. We call them pretextual stops. And these are stops initiated by law enforcement for minor traffic violations with the actual purpose of investigating or searching for evidence of another unrelated crime. So oftentimes, you'll find in the community where you're being stopped for the light above your license plate being out. And most of us didn't even realize we had a light above our license plate decades ago, but I guess we do. And so that was the pretext in certain wards in this city to request something else from that person. So, and I mentioned searching for evidence. So I know we will discuss it in here. It was usually a consent search. So police are looking for something other than just stopping you for a tail light out or the light above your license plate. The use of these stops to investigate have long been recognized as disruptive of people's lives. And some people may think that it's just a traffic stop, but it's more than just a traffic stop. You know, when the lights go on and flashing and you see it in the rearview mirror, you know, your nerves, you're on pins and needles, and you have law enforcement, which we do respect, and we encourage people to respect, coming to your window, fully equipped, with a hand on the gun, and asking you for certain things. And you know, in the black and brown communities, we've taught our kids that they cannot reach for anything. You have to ask for permission. Say, I have my driver's license here, I have my registration here, can I reach for it here and there? So it's nerve-wracking to have that to happen to you. And it's very disruptive, because then you're gonna be stopped, you could be on the way to work, so you're gonna be late for work. And we will discuss later how those things, we as the ACLU, we find that some of those minor stops are not really necessary to go on. And this is what's important to remember. Sometimes people will say traffic stops are for safety reasons. And there's no proven link in Springfield, Sangamon County, or elsewhere across Illinois that increasing the number of traffic stops enhances public safety. Absolutely not. So public safety is not based on whether or not they make a traffic stop. Driving while black and brown. Now, I've been driving while black for a very long time, and you can be impacted because people do not, when I'm stopped, and I have been stopped, they had no idea who I was, but I had an idea who they were. And of course, with me, you know, I understood what was happening, but everyone does not have that wherewithal to understand what is happening when they're stopped, driving while black and brown. And black and brown motorists long have complained about being targeted for traffic stops. Artists, actors, members of clergy, factory workers, and even elected officials of color long have reported being targeted for traffic stops. And this is very true. We've had elected officials in this city to be stopped. You know, when we were given testimony, providing testimony to the Senate and the House in Springfield, you know, one thing that someone said is that I made it very clear that it does not matter where you live. If you're black, you know, you're still driving while you're black. And I shared with the legislature that where I live does not mean where I always am. Because Ward 2, my church is in Ward 2, my Masonic Temple is in Ward 2, my Elks Lodge is in Ward 2, my everything else, the best barbecue in the city is in Ward 2. And I put that in there. And you know, most of my friends are in Ward 2. The American Legion that I frequent is in Ward 2. So someone was implying, well, what are you doing in Ward 2? You don't live in Ward 2. Well, I'm in Ward 2 oftentimes. So it does not matter where I sleep, it's where I am. So, you know, it does not, and we know when you drive in Ward 2, there are certain areas where they're focused on, but, you know, we're in Ward 2. So, and black people, we can live anywhere we want to in this city, and all the other wards. But Ward 2 is a place where you will find me often. So, I shared that, and I think that was very important, so that people will understand that it does not matter where you sleep. You know, we're gonna go places, and black people, our churches and everything are still located in one ward. So, and I mentioned in 2003 when Senator Obama and his being a genius that he is, you know, bringing this traffic stop data to the forefront and collection of it, and also in 2019 for the ACLU to push the legislature to continue to collect this traffic stop data. And you know, when you're looking at this data, and when you have an opportunity to look at this data, you're gonna see things that when you're driving while black and brown, we're not drag racing down MacArthur Boulevard. You understand what I'm saying? At one point in time in Springfield, you could not drive down MacArthur Boulevard on Friday and Saturday nights. They were taken over by a certain group of people, and police were not there, nowhere to be seen. So, you know, it's for equipment violations. You know, and our young people, and I think it's important to remember, the young people get cars that may not have all of the lights working in it, and we used to refer to them as hoopties, you know, and they drive those cars, you know, get them from point A to point B. Getting from point A to point B is extremely important. And so sometimes, you know, the turn signal does not work. And of course, there's never a light above the license plate. And, you know, and tail light may be out. And these are the things that, when you're looking at this data, that black and brown people are being stopped for, are equipment violations. So we know from looking at the data that these are pretextual stops. And Ed, can you do that for me? Yeah. And the goal of the legislation was to demonstrate whether black and brown drivers were more regularly subjected to stops and searches by police officers. The hope was that the data would spark conversations in communities across the state about the way in which police exercise their power to make traffic stops. And when this traffic stop data, police departments should not fear this data. They should take this data and use it and work with their communities that they serve. They're paid to protect and serve. And look at that and say, what are we doing? How are we doing this? And are we targeting certain communities? And if we are targeting certain communities, why are we doing that? You know, because there's a whole thing in Springfield is that, okay, we're going to target certain communities when they have pop-up parties, and we're going to enforce certain things on the books, like tinted windows. Well, I'm going to share with you, in every other ward, other than Ward 2, there are a lot of tinted windows. Just drive around Springfield, there are a lot of tinted windows. So we made this very clear to the police department. Are you stopping everyone in the city of Springfield for tinted windows? And then another thing, how are you measuring the tint on the windows? Well, visually, you cannot measure the tint on a window. There's an instrument to measure a tint on a window. So, you know, those are things, you know, little things that communities of color complains about. And those small things add up to bigger things. And we're going to discuss in this presentation Sangamon County and Springfield Police. You know, after the brutal murder of Sonia Massey, you know, we were discussing this data, and I said, you know, it's unfortunate that no one has ever brought this data to the forefront with the county. And I'm happy with the commission, because we wanted to bring it to the commission. We did not want to sit down again with the police agency, meeting after meeting, to discuss traffic stop data. We wanted the commission to go forward with this data with Sangamon County and the sheriff and making their recommendations to them. Now, we will discuss that later, but so I'll have Ed, we're going to get into the data, but you know, I want you to understand that as a black man, I was uncomfortable going year after year after year sitting in the police department discussing this data, because that's what I was doing. Going year, and they say, oh yeah, okay, well we'll look at this, we will look at that. But we've had some very good discussions with the Springfield Police Department, with the past chief and the incoming chief as well. So, but as an organization, we feel, and we've always felt that some things that these minor stops should not be. And we understand that the policing is necessary, and good policing is necessary, but sometimes some of these things are not necessary. You know, so Ed, we're gonna get into the data on the traffic stops.
Let me, before I jump in and talk about this data and then data for Springfield in particular, I want to underscore one point that Ken made, which is that law enforcement shouldn't be afraid of this data. It's their data. Mm-hmm. This is not the ACLU's data. This is the data that they have reported to the Illinois Department of Transportation. And if you look at the first slide here and look at the Sangamon County Sheriff's Office in the number of traffic stops by year, and we've selected, you know, 6 years out of the past few. 2023 is actually the last year for which we have data. The data is reported in the summer of each year, and it's for the year prior. So we will, in the next few weeks, get the data for 2024. So 2023 is the last year that we have. You know, I would also just note, by the way, on this, that you'll also see that in 2029, the state made a distinction in 2019, forgive me, did the distinction in terms of the way they collected the data to get more aggregate data of more different groups, so they aren't grouped simply by white and minority drivers, but then by specific kinds of drivers. And what you'll see here is, you know, what you see in this instance is stops were increasing prior to the pandemic. They fell somewhat dramatically after the pandemic and have begun to increase on the part of the Sangamon County Sheriff's Office certainly over the last year. In that, you're also seeing still a disproportionately higher number of drivers of color who are stopped. And where that really shows up in, if you look beyond the raw numbers, are in this so-called stop ratios. So for 2017, if you were a minority driver, you were 2.26 times more likely to be stopped than a white driver driving on the same roads in Sangamon County, 2.4 times more likely as a minority driver in 2018. In 2019, if you were a black motorist, you were 2.8 times more likely, a little less likely if you were Latino. In 2021, that number escalates to 4.4 for black drivers. Again, the Latino number is still below 1, so still within what you would anticipate for drivers. In 2022, coming out of the pandemic, the stop rate for blacks goes down just a little bit as those traffic numbers were falling. Again, Latinos are falling, are still below the rate. And then for 2023, the last full year for which we have reported data to the Department of Transportation, black motorists are nearly 3.5 times as likely to be stopped as white motorists, and Latinos are now a little bit more likely than not to be stopped by those Sangamon County Sheriff's Office police in that circumstance. One of the other things about traffic stops that we often look at, one of the things that the data is reported, it tells you who got stopped, right? Who are they, including their race? What's their age? What's their gender? What's, all of that kind of demographic information. The second thing we ask is, why were they stopped? Were they stopped for an equipment violation? Were they stopped for speeding? Were they stopped for whatever? By the way, the last reliable Department of Transportation data looking across the country, upwards of 90% of all motorists on the road at any given time are committing a traffic violation of one sort or another, going 1 to 5 miles an hour over.
What percent?
90%. Crossing a lane line without a turn signal, having driven down from Chicago this afternoon, I can assure you that's happening out on I-55. Or engaged in some minor equipment violation. So the question is, why are they stopped, right? We now know everybody, when you have a law that everybody breaks, the question is, who gets stopped for it? Who's it enforced against? Then the third question was always, what happens once you stop? Because that's where you get to this question of pretextual stops. And as you can see here, and remember in these numbers before, where we were looking at where black drivers, for example, were just a little over 2 times more likely to be stopped, they were then, once they were more likely to be stopped, they were 2 times more likely to be subject to a vehicle search. And I will tell you the numbers we didn't share with you, and I would encourage you all to look at this data on the Illinois Department of Transportation's website, because one of the things I will tell you, these vehicle searches, there is very little contraband that is found. Right. One of the things you will always hear is, well, we had this big gun find a couple of years ago, and they showed the guns out on a table, but that doesn't count for the, 30 and 40 and 50 people who are stopped and detained for however long it takes where their car is searched on the side of a road. And here you can see, again, the number of searches increase, and while black motorists, again, are more likely to be stopped, they remain more likely to be searched as compared to white motorists. And that remains, I would argue that these numbers in particular have remained stubbornly consistent over the 20 years that this data has been reported.
And I want to share that, at some point, I want to have a forum with the black community and community of the black to listen. But for people to know it's their constitutional right to say no. You cannot search my car. But what happens is that, come on, buddy, come on in, you have nothing to hide, so and it's always that way.
Well, one of the other things the data points out for in every community is what the rate is for people accepting or acceding to a consent search, and that number is over 90% as well, and that is consistent, frankly, across all of Illinois. It is consistent across most ages. It is consistent across race. It is consistent across gender. So moving quickly, this here we took a look, and again, we only looked at the top two law enforcement agencies in Sangamon County. There are, others that we could have looked at as well. What you see here is traffic stops in 2023 increased or have gone back up after the pandemic, closely approximating the 2017 numbers. They're not quite back up to where the 2018 numbers were. And you see again this pattern where as stops increase, the number of black motorists who are stopped increase, the number of Latino motorists who are stopped increase. And when we look at the stop ratio for this, for Springfield, what we see is we increase from minority drivers generally in 2017 being 2.2 times more likely to be stopped to today, or to 2023, when the last set of data was released by the Springfield Police Department, where you had 5.7% black motorists were 5.7 times, not percent, forgive me, times more likely to be stopped. And again, you see that this 5 times number has been consistent over the past 3 years. Again, we're waiting on the new data for this year, and we'll be able to see what that looks like. If you look at vehicle searches for Springfield, the Springfield Police Department, I do just want to look at that last number, these last 3 years, where the number of black motorists who are searched are heavily outweigh the number of white motorists who are asked for a consent search of their car. And so that's, those numbers are things that we have been seeing.
And I would like to add with this is that, we're looking at Springfield and Sangamon County, which Springfield is in Sangamon County, but Springfield is unique in itself. In a lot of ways, it's not good. You have 7 police forces, departments, within a couple of miles of each other. You go a couple of blocks, you got Springfield Police. You go a couple more blocks, Park District Police, always out there. A couple of more blocks, Sangamon County Sheriff. And then, we have these donut holes, which makes no, we have these donut holes. Some of them were like Jerome. People are not driving through Jerome. It's just the street goes there, and part of it belongs to Jerome, rest of it to Springfield. Then you have Leland Grove. Oh, yeah. Southern View. Yeah. Grandview. And then if you go close to the Capitol building, you have the Capitol Police, right? They got a police force down there, and they do stop people. And then Joanne's former employer, the Illinois State Police, they're in this city. So, and I want to say that because there are 7 different police departments that are interacting in the city of Springfield. And a lot of that interaction happens around certain wards in this city. Because people in certain wards in this city say, we see state police unmarked. We know that they're parked up in this cut. And I'm going to tell you, if they say it, if it's in the street, it's probably true. There's an element of truth to it. And so, you see all of these things that are happening, so there's no way to get away from being policed. It's not like you're in a town where you got 1 police force, but you have 7 different ones. And the 7 different ones all collect their data. And their data is looking exactly like the data from the larger ones. So, you got those, and people in this community and in this forum right here are familiar with those smaller places and the interaction with those smaller places. But we understand that the commission is looking beyond just Sangamon County, because if you're looking for that whole thing, you have to look at everything in Sangamon County that happens. So in the policing. So, it's important to look at all of those others as well, because that impacts the community and the relationship that the black and brown community have with policing. So it's not just, we can say Sangamon County Sheriff. You got all of the others, so that comes to the table. So that's on the table with you.
Let me me just say a word. So recently, folks from our office in Chicago at the ACLU of Illinois and folks from the Springfield chapter, including some people who are here tonight, have been meeting with the Springfield Police Department to talk about this data. And they've taken 2 steps that I think we should highlight because I think they are important steps, not maybe the ones that Ken and I might exactly want, but I think are important. The first is that they are launching a program to deal with equipment violations. I'll let them announce how they're doing that and the way they're doing that, but I will say it's an idea that Ken actually brought to them about making sure that we don't have people stop for repeated violations, because you know the interference in your life of being stopped repeatedly is sort of where this gets to be the worst. And the second is that they are tightening the justification that an officer can use in order to ask for consent to search someone's car. If an officer has to have what is called an articulable reasonable suspicion for doing that instead of just a hunch, you know, that changes a lot about the way that officers, you know, the way that officers think about this and the way that officers approach someone when they're meeting with them. I just want to say, you know, I thought Ken did his usual eloquent and beautiful job of sort of describing the experience of being, you know, a black driver and experiencing this over a lifetime of driving. You know, and Ken is right. One of the reasons that this law that collects all this data was originally passed in 2003, one of the reasons we started collecting it, one of the reasons that our organization has put a lot of resources into getting the data collection continued and now made permanent is because we have spent most of 2 decades. And I will just say, I had hair when this started. But we have spent, but we have spent most of 2 decades arguing over what the data means. And the reality is that, as Ken was describing for folks, the data is just reflective of a lived reality and an experience that they have every day. And instead, we have spent, you know, a lot of time thinking about, talking about, you know, what the data means. Oh, is this the right measure to use for how many black motorists there are in this community as compared to using this algorithm or formula in order to create it? That's not the point. It was never the point to have some precise thing. You know, this data isn't used to come and sue communities, you know, for racial disparities. What it's used for, what was intended to be used for, as Ken said earlier, was a conversation. And if I, you know, and when I heard you talking earlier, if I were thinking of a recommendation to make, a recommendation ought to be that every year when this data is published, that a local police department ought to have a public session with the people they serve and protect and talk about what the data means to them as police. Not to make excuses about it, but to say, this is why we police in this fashion. This is what it means. We're troubled by this. We're not troubled by that. To just have a dialogue. Because that's the part that's been missing for, as I say, 2 decades of doing this work.
And it's important to have that public forum and that public meeting with the public. I think that police agencies need to understand and hear from the communities what's happened, that impact that has happened, that happens to them. And I think the longer that police departments say, no, I do not want to have a community forum, is that it creates this more hostile relationship. These minor traffic stops, which most of them are unnecessary, creates this hostile relationship. So when people say, well, why is it that the police in the community cannot get along? Well, a lot of things are simple things. And then you have to start somewhere. And I agree with Ed that when this data comes out, those police agencies need to look at it and get with those communities and sit down and discuss it with the community. And so the community can still tell them what's going on. I mean, we can be conduits, but it's very different for the community to come up and say, you know, this happened to me, and this continuously happened to me, and it always happens to me. And so, you know, there are a lot of things that police in this country and policing, there are a lot of changes that needs to be made in this relationship with the community, which it is paid to protect and serve. And we understand that now. This commission understands that. And it's unfortunate that someone had to die for us to really understand that. And it didn't just happen then. It's been happening with us for a very long time. So if you look at all of those people before Sonia Massey in the police, that's been happening for a very long time. And all those people that are unnamed that has happened to throughout the South. It has been happening for a very, very, very long time. So, and I appreciate the ACLU, and I appreciate the ACLU allowing me to push them to do things that I want them to do. And they do, because it's extremely important to me for that to happen. And it was extremely important for us to come here tonight to share this with you. And I want everyone to understand that we are not after the police, because this is not our data. But this is a tool, and it's cliche to say it's a tool in a toolbox. I never understood that. I got an empty toolbox though at home, I really do. But it's something that we need to use as a community. And it's something that the community should push the police departments to use. And we pay nice salaries in Springfield to our police officers. We want to make sure that they live well. So there's absolutely nothing wrong with them having a forum like this, discussing it with the community. Now, you're going to have to stand there and take your dings and the arrows that shot at you, but that's something that comes with the territory. Because if you cannot stand up there and take it, then there's a question mark, like, should you be there if you can't handle this? So, but Ed, you probably want to say, but I do appreciate this opportunity. And I appreciate Ed driving down to do this with us. And I appreciate you all being here tonight. And we're at the questions part.
Yes, questions. Sunshine first.
Thank you for this presentation. This was a lot of good information. I had 3 questions, but one of them I forgot, so I'm just going to ask 2. On the Lights On program, I think it's called, do you know, this might be a question for the police, but do you know if it is still optional? So like if they pull you over and you have a tail light out, can they still give you a ticket, or do they have to do the voucher now that once it's in place, or can they still say, no, I'm still going to give you a ticket, even though we have this voucher program?
Well, what's supposed to happen is that they're supposed to give you a voucher.
Right, the others, yeah. But I'm wondering if there's officer discretion.
Well, and I think the police department, you know, they jumped the gun on us and put this out there before they did the press release. They were very happy. So we started getting calls from the press, and I'm thinking, well, they hadn't put the press release out yet. So, man, I don't know what to say. But then, it's interesting how they leak information that makes them look good. So I said, oh, okay. But they're supposed to explain the program. And the Lights On program, it came about with what happened with Philando Castile. And that whole thing with a light being out. And so we brought it to the police department because we were looking at this traffic stop data and looking at those violations that they were finding on cars. It was like lights and stuff being out. So you're stopping the majority for that reason. So there should be something. If you're concerned about that being a safety issue, and most people cannot, and a lot of people that you're stopping over and over cannot even afford, can barely afford to get groceries and pay their mortgage or rent. So you're going to stop them again, and then you're going to stop them 2 days later for the same thing. So is there an opportunity to work with the community to say that, we will do something to help, you do this. Now, I suggested, like, go to AutoZone, but they said, well, we're going to do something better. This will work better. And I think it will work. But no, they're supposed to give them that voucher and for that. And so it's supposed to be some way that they can record that. Now, this data that's submitted to IDOT, police department record more data than what's submitted to IDOT. I want you to know that. They got a lot of data in there, and it's just a matter of telling them, we know you got a lot of data, so this is the data we would like to see. So they record a lot more data. So there's a way for them to record that they've given you a voucher. So if they stopped you again, and you've had ample time to go to locations, and they're supposed to put that out in their press release. These are the locations throughout the community that will do this work. Because sometimes going to AutoZone is just for a bulb, but some things may be wiring or something like that. So that was the whole idea with it.
Okay, thank you. I can follow up with them on just if there is any officer discretion, because I know like when marijuana was legalized, there was officer discretion still at play. They could, but they didn't have to in certain situations. So my other question was, do you all have data compiled in a way that shows, I guess the best is just like wasted effort? So you talked about the stops that happen and how they don't result in anything. Do you have it? I know that it exists because you can see it in what you've said, but is it laid out in a way that shows like 90% of your stops result in nothing or whatever?
This is really a key question, and let me say that after 20 years of collecting this data, this is the chart that you get for a law enforcement agency in Illinois up till now. One of the things that sadly happened was when the original Data Collection Act was passed, the state was supposed to create a commission that looked at this data and looked for better ways to present it and better ways to share it with the public. And for a variety of different reasons, that never happened until about 3 years ago. So the commission has been meeting now regularly and making recommendations. And I think the Illinois Criminal Justice Information Authority is now looking at ways to share this data in a much clearer way that looks at, and this is, to answer your question specifically, why was someone stopped? And then to be able to measure, sort of what the effectiveness of that stop was, what the outcome of that was, how that helped in terms of, any sort of advancement of public safety, or, was it something, you see, I will just tell you, without going into all of it, but in Chicago in the last 2 years, they've jumped up to making more than 500,000 traffic stops a year. And like a small fraction of those actually result in any kind of fine or penalty or contraband. And, we have limited resources in Chicago policing, just like we do in Springfield or Sangamon County. And one of the realities is, as a result of that, is we're putting this enormous force out on the streets, and we're targeting them at people and making repeated stops for equipment violations and not really doing anything about public safety.
And we also wanted them to look at, with the traffic stop, and the request for consent search, we want to know what you're finding.
Yeah, that's important.
And that's something that we know that they got it internally, but they said, well, we just have to figure out how to get it for you.
That's actually in the traffic stop data.
Is it?
Yeah. In the traffic stop data, there's something called a hit rate that tells you once you search a car, if you find something and what you find. And what you'll find is the contraband, I think the last time I looked statewide, was found, it's less than 2% of the time in a search.
It's a huge loss.
Brian? Oh, and then Brianna after that. Brian, go ahead.
Yeah, just a couple questions. With the last 20 years in particular, with the Law Enforcement Training Standards Board, has there been anything that's changed with standards that have been set? In this area, traffic stop?
Not around this. There has been some changes, as you know, made as part of the Safety Act, but not around this area in particular.
Well, I would like to add that when they started collecting this data, they did not have dash cams. They did not have body cams. So, you look at that decades ago, that did not exist. So what police departments were saying is like, well, we need to figure out how we can protect ourselves. Because people and of course, people were getting, if people say they got beat up by the police say, well, we didn't beat you up. And then so you got that whole issue with that. So now you have the body cams, you have the dash cams. So a lot of things came out after that. You know, those things did not exist. And we all know how important those things are now. Because everyone say, well, I want to see the body cam, I want to see the dash cam. And of course, some of them shut them off, right? But we still want to see the body cam and the dash cam because that's extremely important. 2 decades ago, they did not have that. And Joanne, you know that by work, they did not have those things. So all of those things, so out of those discussions, and those came out of discussions with communities. Now there are police departments that do sit down with communities and have those discussions and how best to serve the community. But I just want to share, those are 2 things I know that did not exist and were not just on everybody's tip of everybody's tongue when something happens. So now it is. It's like, I want to see the body cam footage. I want to see the dash cam footage. So some of the footage, it breaks our heart to see it. But when what happened, the brutal massacre of Sangamon, Massey, that body cam footage 20 years ago would not have existed. And things like that happened 20 years ago. Yes. So.
Yep, just one more. It's a little bit more on the, Ken may be more for you, but maybe even from the ACLU perspective. You had mentioned the house parties or things like that come up, pretexts that come around those types of things, being in a neighborhood more than others. It's a Ward 2, 1. When Alderman Gregory is talking to Chief Bell, former Chief Scarlett, from ACLU's perspective, what is the right conversation to have when he wants to talk about an elder's lawn getting torn up and maybe what can we do to be out there? What does that conversation look like that we'd be all okay with?
I think that, so let me start by saying that this issue of pop-up parties is the one that I've heard over the last couple of years. As of last week, I've been at this job for 26 years. It's something every 2 or 3 years, there's some other different name that's given to it. There's some other different thing, but it's the same question. And I would say that there's 2 things that almost always are part of that discussion, that there should be more penalties for those things. We should have a local ordinance, we can punish the party thrower, or we should be able to do this, or alternately it is a sense that we've got to just crack down on everything, and there's never a discussion about, well, why is it that this happens for young people, right? Why are these the things that occur? And I laugh at sometimes because I feel like I go through this cycle every 2 or 3 years where we talk about this. Here's what I would say. Number one, the police have enough powers to disperse crowds and break up parties today that they don't need any additional powers or orders or capacity to be able to do that. The second thing is why is it we're always looking to whatever the way to break up the party is, but never figure out, are there alternatives that we could do? Are there other kinds of community services? And we never seem to get to that second part of the equation.
And that's why I mentioned MacArthur Boulevard in the 80s. Y'all know what I'm talking about. From Baskin-Robbins ice cream shop all the way down Wabash Curve, you went all the way down to Chatham Road. You did not drive down that road unless you were dragging up and down that road. I'm serious, and that was no joke. And I don't know how many alderpersons, they weren't aldermen, man. I'm just sharing with you. That happened. And that was dangerous. And some people had to cross that street. You had to go down that street. You tried to avoid it, but you still had to cross MacArthur Boulevard and Wabash. And it was wall to wall, hot rods and everything. So it's just a different time. So I'm just sharing those. That's why I brought that up, because I want people to understand that this is nothing new, but those things did happen with young people conjugating. And they were up and down there, and I know because I had to go through there. And so, but I don't know. The conversation that Alderman Gregory has with the police is the conversation that Alderman Gregory should have with the police. we cannot dictate the conversation that Alderman Gregory has with the police. Thank you.
Brianna?
First, thank you for this presentation. I feel like there was a lot of data that I needed to look at to be able to bring it to other organizations that I speak with. But you've mentioned being involved in many meetings over a couple of decades that the public hasn't had access to because we're not invited into those conversations. So if you can maybe give us an idea of what their explanations could have been kind of through the years, or because I know you mentioned that a lot of times they just kind of relate the traffic stops to being related to like equipment failure or something along those lines. But when you ask them about the data and like present the numbers to them, what have they said to you before, and has those explanations changed?
Yeah, I think there's three basic things that we've heard over time, and it's consistent in these are the three things. They might not always be the same for each police department. The first is you will hear an argument that the data isn't correct, right? The data's all wrong. Oh, why look at our census data. Our census data doesn't match what you say our driving data is. But, if you look in, as Ken was, articulating earlier, if you have a white enclave community that black or brown motorists drive through, the driving population is much different than the actual population. And so there'll be lots of problems or lots of conversations about the formulas and the data. So that's one. The second thing you'll hear is we're just going where people, this is one that we heard in a community earlier this year. In these neighborhoods, we get more 911 calls. So that's why we're making more traffic stops there. But if you ask the follow-up question, which is, are you making traffic stops related to the 911 calls? The answer gets a little bit softer. And tends to evolve a little bit, I would say. And the third general take is you will get officers who will swear to you that traffic stops lead to less violent crime. And you ask how that is, and nobody articulates it, but we have had successive superintendents of police in the city of Chicago who believe this is an article of faith. I don't question that they believe it. It's just they have no evidence for it. And so they have literally established quotas for the number of traffic stops that are made, which is why that number has escalated so rapidly. But there's absolutely no evidence that then results in, decreases in terms of violent acts in a community.
And what we did not report was the pedestrian stop data. And in larger cities, like Chicago, people walk more and use public transportation than they drive. Springfield is different because you drive everywhere you want to go. But that pedestrian stop data is important as well to look at. Now, we just throw Chicago out there, that stop and frisk. They were stopping everybody in certain neighborhoods in Chicago when you were walking. So that whole thing was stop and frisk. I mean, that's on the national level now. The current administration said we want to bring back stop and frisk. And but we didn't report that. It's just the traffic stop data. Pedestrian stop data looks very different in larger municipalities, especially has good public transportation and where people use it. So you're going to have communities where people are always walking in communities. So, Brianna, I'm not sure that did we answer? Did you have a second? But I think I want you to understand. Police, we share with the police that you cannot be afraid of the community that you police. And we share, and I don't share with young police, but young police officers got to understand. You may come from a small town where you've never seen a black person, only on TV, and they put you smack dab in Ward 2. If you have a fear, then that discussion needs to be had. Because that's not a good position to be in. If you fear the community that you are paid to protect and serve. So we always say to the police, it's important that you discuss it with the community. So with them doing it is another thing. You know, it's still on the table every meeting we have. And that's going to come up with us pushing that there needs to be a public forum, a conversation with the public on this data. It's okay to have it with us, but the community needs to hear it from you, and you need to hear it from the community, not just us. See, that you can be comfortable with us because it's only a couple of us, but then there's a community out there. There's a whole community out there that wants to discuss that with you as well.
Correct. Jerry, and then Susan.
Gentlemen, I'm a retired sergeant from Springfield Police Department. I do not speak on their behalf. This is from my own personal experience. Really appreciate the information, the structure that it was provided in. I wished we could add, for me personally, I could have had feedback way back when they first started the traffic stop sheets. I retired in 2019. I don't know if I repeated that or if I had already said that. And I think there was some inquiries made from some of the officers that we'd love to. Why can't we meet? It was done from the staff side down, that deputy chiefs, I believe it was, and then whatever individuals they had in those rooms were invited to have these discussions, and it all seemed so mysterious. And I just wish I would have had that opportunity back then. Pop-up parties real quick. And again, I'm dating myself, but I can remember these, my sisters, from the 60s, 70s, along that same strip of road, but from Tops Big Boy down around the Mickey D's and then back again. And then a lot of the pop-up parties, we call them something else from many years ago. They were just, everything else is closed and a group would meet and then they would start getting out of hand potentially. We would get lots of calls from neighbors affected by it, whether it was just the noise or lawns or whatever it is it might be. But oftentimes there would be fights breaking out and as kids are prone to do sometimes, break windows. And so it was just a matter of addressing that. And then lastly, way back when, and for whatever reason they stopped, we used to have beat meetings where there would be an open discussion with the members of that particular, now it's broke down into wards now, but different beats. And the churches within the various beats would actually host them, and they had a phenomenal response from both sides, where the community had a little better understanding of why we do what we do sometimes, and then also, more importantly, vice versa. We understand the insight that the media or the individuals have, and I think a lot of times law enforcement forgets that a lot of times when you're in someone's house, this could be the first time in their lives that they've ever had law enforcement standing in their room, where we have that cynical side where this is the 50th time that I've dealt with such a situation or something. So I think having that information way back when would have afforded a lot of personnel a lot better insight. So I really appreciate the presentation, though. Thank you.
But and I appreciate you sharing that with us. I think so people can understand the history, just go back, what pop-up parties were 20 years ago. And you know, one thing that we discussed with the police department were the jump out boys. And so you're gonna jump out on somebody and they're not gonna be afraid and they're just gonna stand there. So they've changed that policy as well with jump out boys. So it's not done like that anymore. They have to identify themselves. You have to come up, you have to have your lights on and everything, because we know there were several incidents that happened with young black boys that they jumped out on. And so, you know, it was like the kids were like terrified. You know, like, my God, who is this? So you don't know. You know, you're coming out of there and bum rushing them. So, you know, so the Chief Scarlett at that time, they changed that policy on that with the jump out boys. And it was a street crimes unit. I mean, we just use that vernacular, jump out boys, but I think everybody understands what that means.
That leaves me one quick thing. I was in charge of that unit for 3 years. No, there's no whoops involved here, because when I first got into it, there was a lot of things I changed on it, and that was one of the things I addressed. Because for nothing else other than our own personal safety, these individuals have no idea who you are. There may be some recognition within that vehicle, but so I appreciate you saying that. So some of that started before, because I was completely against that shock and surprise mentality. I get sometimes you come across something that potentially could be some illegal activity, nothing minor. We were always looking for the guns and that kind of activity we were trying to curtail. But it's all in the methodology, correct? And anyway, thank you, sorry.
Thanks. Brianna, did you have a follow-up?
Yes, I have one more question. So we're talking about, like, they should have a public forum for people to come speak, but people are scared of the police and they don't trust them. And I personally wouldn't want to spend my free time going to a meeting just to listen to the police explain to me why they think it's okay to pull over black people more than white people. So, and like, I know they could, other solutions would be like make a video and post it online, but like not everybody has access to the internet and the video could come across as insincere. So do you have other recommendations besides public forum that could either start to, maybe this is a really big question and a really big ask, but like start to rebuild the trust within the community first before we tell people, come listen to the police explain their lives away? Or like what steps you think with your expertise might be the best to get it to where people will feel comfortable to have conversations with the police?
And you probably was listening in on our conversation earlier, but that
Yes.
we had that conversation, Ed and I, on maybe there should be there's another way for us to have public forums outside of just the police, and doing that. So we did discuss that. We discussed that tonight on how to do that. And we don't have a way, we haven't figured out a way to do that, but it needs to be done. And but we, at the beginning, we did not want to take that responsibility as an organization and say, we want to have this for the community. We felt that it was necessary for the police, but we understand there's a point, you made a valid point, is that the community is not going to want to come there. So it may have to be us or somebody else that have that community forum and have people there that are comfortable, and then you move it to another level.
Or a coalition of partners that do that.
Susan?
For what it's worth, I'm aware that there are conversations about trying to put together such a coalition conversation. I don't think it's ready for prime time, but I'm aware of it. So I have a couple questions. Some are one is shorter than maybe the others. The first, I read the news about the voucher program and that the vouchers would go to one of 4 vendors in town who could do that service. And I'm curious if you or maybe anyone else knows if any of those 4 businesses receiving the vouchers are black-owned.
That I do not know that. That's something that the Springfield Police Department, they put all that together, they would know that.
I would be really interested to know if any of those 4 are black or minority owned, or if this voucher program is going to be directing more city funds to white-owned businesses. So that's a question that I'll ask somewhere else. And then I was really surprised to see the number of stops drop, and I know we skipped 2020, COVID year, I guess, but the number of stops between 2019 and 2021 dropped by half, by 50%. Is there any reason besides COVID?
Not that, so I think there's, I can give you speculation, I can give you what other law enforcement officials have expressed elsewhere throughout the state. During COVID, when officers didn't want to make stops because they were afraid to interact with people directly or concerned about interacting with people directly and stopped doing that, the theory is that they just got out of the habit of doing it, and it's taken some time for those numbers to start creeping back up, and that's the reason it fell. But I am, just to be abundantly fair about this, I don't know.
Okay, given that speculation, was there a jump up in crime when there were fewer stops?
It depends on where you're talking about and
Sangamon County.
Yeah, and who you're talking to. We did see some bump ups in crime during COVID, but I think that, or just coming out of COVID, but I don't know that any of those were necessarily related. And as we've said, even people who've looked at this can't find any intersection between the number of traffic stops and crime when you look over a longer period of time.
Yeah, I'm interested in that correlation. And then I was stunned to see the numbers on the searches, I believe in 2023, and you had a lot of numbers, and I wish for future, it would be really handy if we could have some of the data to look at. It's really hard to, this screen in particular, we've got a blue echo something.
Let me do this. I will pull together, I've got in an Excel sheet that's a little bit cleaner and easier to see than this. I can send tomorrow. Yeah, and so that you can do just that.
Well, the slides were okay. This particular screen, there's
Yeah.
something wrong with it,
Yeah.
so there's a blue echo.
I-
But the number though, if I got this right, the number of searches for white folks was 62, and I presume this is a flat number. And
Yes, 62, yes.
and the number of searches for black drivers was 1,077.
Yeah.
That is correct.
Yeah.
That is more than, that's like 18 times as many searches, but that doesn't take into consideration the disparate numbers
There's
for
the disparate
percent,
number-
for
there's the
population.
Right, there's the disparate number in who gets stopped, then there's the disparate number in who gets asked consent
Right.
to search, and then there's the final action of actually conducting the search itself. So there's kind of 3 steps where one is concerned that bias can be built into all 3 steps. So that's where you get to that, kind of that crucial point, as you say, where the searches are actually taking place.
So, and I am not a mathematician.
I was
If I
promised
did
there
my
would be
math
no
right,
math.
and someone else can check me on this, that would mean a black driver was 86 times as likely to be searched as a white driver in Sangamon County.
Can I tell you that's right, as far as I know, because I was told there wouldn't be math either. But number 1, number 2, there are communities across the state of Illinois where that number for the likelihood to be consent searched is worse than that.
So, and we have some folks in the room who know this fact intimately. Personal experience, research, that it's not a shock. I've seen, thanks to Ken, I have seen this research in previous years. But as a community, everyone should be shocked by that number, and that is an absolutely unacceptable reality.
Yeah.
And there should be no excuse for it.
I've always, the only analogy that I could ever think of, and I'm getting to an age where fewer and fewer people understand this reference, but I'll just say that the secret bombing of Cambodia was not a secret to the Cambodians.
Right.
Right? The data is not a secret to the people who are living this in real time. Yeah.
That's true. Well, Susan, I congratulate you on your great math and the way you use the statistics, because I think you're precisely right, that black motorists in 2023 in Springfield were 70 to 80 times more likely to have their car searched than the rest of the population. And it is absolutely appalling. So, Veronica?
Thank you so much for the presentation. For the state of our country when it comes to immigration and the outrageous ICE activity throughout the country, having the Trust Act is such a relief for many reasons. So I think it's really important to continue to do Know Your Rights and to talk to people about their constitutional rights, which includes the traffic stops. We continue to do Cyan, Know Your Rights for immigrants when encountering police and ICE separately. Those are 2 different searches, 2 different outcomes. And I think that is so important to continue to tell ourselves and educate our friends and families that life-altering stop that happens to our black kids, brown, when it happens to immigrants, it affects the likelihood, the livelihood, the next step in any type of adjustment of status because of the clause of good moral character. And because Homeland Security, to uphold the clause of good moral character when you apply for a work permit, a green card, or citizenship, will use traffic tickets to deny an adjustment, right? So I'm not talking about DUIs or, suspended license. And I'm talking about a traffic ticket and how life-altering is. And I think this is why I believe that we need to work in coalitions to continue to do Know Your Rights, to understand our constitutional rights. And to the comment from Brianna, I think it's so hard at this time to trust our police with the caveat that in Springfield, we are expecting the Springfield Police Department and the sheriffs and law enforcement not to collaborate with ICE in absence of the criminal warrant. What we see in the rest of the country is the collaboration of police department with ICE in ways that are so outrageous in these kidnappings that are happening all over. So really, as an umbrella thought, can we trust the police? Where do you live, right? So thank you for all you do, but I think that we need to continue to teach Know Your Rights to all populations.
Okay, thank you. Calvin, this is the last question.
Well, first off, I just want to say that I'm not surprised with the numbers or even shocked. I've seen it when it came out, see it every day. See it with a lot of pretextual traffic stops that happens on the east side, especially with the Springfield Police Department Street Crimes Unit, their proactive crime units. Read about pretextual traffic stops all the time in police reports, to whereas, say somebody didn't signal within 100 feet of turning, they get pulled over. Doesn't necessarily have to be a traffic light or anything like that. They just get behind them and try and find some reason, such as a legal tint on the window. Oh, well, it looks too dark, so we're gonna still pull you over. So I just wanted to say that. One other thing, too, that I wanted to know is the ACLU, are they monitoring vehicles that are being forfeited? And for the people who may not understand this or know this, so basically, if an individual gets stopped, sometimes they can go to the courts and they can have judges rule that they're not going to give you back your vehicle. No certain amount of money or anything, they just keep your property. So I wanted to know if the ACLU is looking into that, because it does seem as though that there is a uptick in that here in Springfield, Illinois.
Oh, that's interesting. So let me say, a few years ago, we worked on legislation that actually, I'm happy to say, Governor Rauner came to our office to sign, that would that change that system to shift the burden for seizing someone's property back to the state. They had to have a preponderance of evidence, as opposed to you having to prove that your material, your belongings weren't engaged in any criminal activity. Because again, remember that civil forfeiture does not require a criminal conviction for the property to be seized. I'm happy to say that just in this legislative session, there was a follow-on bill that actually improves the way that the data is collected about that. So to your question, we did this change to the law. We couldn't really see how it was working because the data wasn't collected in a way that we could really analyze and look at. That should be getting better in the next year and then on after that. And so we're hopeful that we can look at places where there's a sudden spike in that, where there's some change in that. And so that is something you'll see in the very near future in Illinois.
Okay, great. And then another question too. So on the stop card, or the form that they fill out when they fill somebody in, it's been about a few years before I've actually seen one in person. On there, is there a section to where it's either the person consented or they had probable cause to actually go in the vehicle?
Yes, if the requirement is that, or when they record that information, if they have probable cause, they have to say what the probable cause is. If they are asking for consent, they're not actually required to justify what the hunch was, what the thing was that led them to do that. That's not on the state form. Again, that was one of the things that the Springfield police are looking at, is changing that so that the officer would actually have to clear through a supervisor the reason they're asking for consent to search, which again, in our minds, really turns it into a probable cause search as opposed to a consent search.
Yeah, I agree. Also, a suggestion as well is that the next time that you guys go into a meeting with the chief of police, I don't believe that there are any dash cameras on any of the city of Springfield police vehicles whatsoever. So my suggestion would be to recommend, at least starting out, that there are dash cameras on the street crimes unit vehicles as well as the proactive crime unit vehicles as well. Because if you ever take a look at body camera footage, they turn it on right before they pull somebody over, but it doesn't necessarily interact or show, you know, if there was actual probable cause to pull an individual over.
Okay, thank you.
Okay, so thanks so much, Edwin, and thanks so much, Ken. We really appreciate it. Great data. We will continue this discussion for sure. So now it's time for public comments. These comments are very valuable to us, welcome and essential. The list is coming right now. We'll stick by the same process that we've had in the past. There are 6 people who have signed up for public comment. Comments will be limited to 5 minutes for each speaker. And the public comment period is limited to less than an hour, so we'll be okay on that one. So the first speaker, and would come up to the microphone right here, is Anthony Hamilton.
Hello, everybody.
It's on.
It's definitely on. My name is Anthony Hamilton, and I'm with a program called Mosaic Partnership. It is a national program that's been in Rochester, New York. It's been in Milwaukee, Wisconsin for 2 years, Greensboro, North Carolina, and currently in its 4th year in Topeka, Kansas. Topeka, Kansas have actually had 150 people go through this program. What the program is, it's built on creating deep, lifetime, strong relationships between the white community and the black community and people of color. And so it's been very effective in those communities, and we are now working to get it started here in Springfield. I've sent information to the Massey Commission at your Gmail account, all the information, what we've done in the public. We've had a couple of public presentations already in 2024. We're in the process of finalizing things for right now. And so I was hopefully get an opportunity to present this to the commission and talk about it at another time and time. I'm going to hand this out. This kind of gives a quick recap.
Okay. We will do that.
Basically, what we're trying to do is create a 7-month program here in Springfield. It was 9 months in Topeka, Kansas. Topeka, Kansas also has high school students now involved in their program, so they've gone from adults to actually including high school students, and we want to also have the same thing here in Springfield. It is a 5-year program. We're currently working with a foundation to cover the cost of the first 2 years of the program, so it's free to the community. It's just a matter of working together to get this off the ground. To accomplish this, we'll have to create what's known as a Springfield United group. There's a governance structure as far as just how things are structured. There's a steering committee, there's local advisory people on there, there's coaches, there's partners, and different things of that nature. What's unique to our program is you have to have a 50% personality match. So we do an algorithm that's run, a tool that's utilized, and you get a 50% match. What we find is that when we match people at 50% and above, they tend to stay in the program, they tend to deliver lifetime. The hard question we ask everybody at the end of the program is, you just met this person 9 months ago. Compared to your best and closest friends, what is your level of trust with this individual you just met 9 months ago? On an average, it's been 80% and above. So I just met you 9 months ago, went through this program with you. There's classes, there's different coaching and different things of that nature. 9 months later, I trust you at the same level at an 8% level that I would trust somebody I've known all my lifetime. So this is part of why it's been successful in these other cities, and we feel like this is something that's going to be very valuable for the Master Commission to consider as potentially what can help. We've met with the mayor. We've asked her to put at least 10 police officers and the chief of police in this program for going forward in that first year. We have United Way as our fiduciary partner as far as a local council. We've worked with the Sangamon County Growth Alliance. We've worked with all these different organizations. We've met with on a consistent basis to present this program to make sure that they're fully aware of what we're trying to accomplish. So again, all this information has been sent to the Gmail account, including what we do as a public side to the presentation. There's a real recap there in your hand, and there's further information available if anybody wants to reach out back to me.
Thank you very much.
Thank you.
That sounds good. Next is Brianna Eilers.
I'm still alive. So I am very appreciative that mental health is being talked about, and I want to stress why. I recently just came out letting everybody know my own story, and I actually found out not too long ago that I was groomed by a man that was 10 years older than me. He found me whenever I was a child through an app that I played on a game with. The reason why I mention that is because my family is mentioned in Epstein's book, and if I am dealing with it, and I know there is one other person who is my age who is also dealing with it, she does not know yet, and I'm not going to be the one to tell her. So I can confirm that it is still currently happening here. The family that is mentioned in the Epstein, the side of my family that's mentioned in the Epstein files, or Epstein's black book, I guess you can call it, attended the Church of Christ. And so they were evangelical Christians. And then on the other side of my family, it was all Republicans. If you go through all the history of Springfield, you find that the Democratic side is normally the Mormons and the religious type. The Republican side is the KKK, which, why are we dealing with racism? Because the KKK, and we have it very heavy here in Springfield. Everybody wants to say was, but it obviously is not was, it is. So thank you for listening.
Thank you. Yeah. Ken Pasha. Yep. He stepped out? Okay, Sam Cannon.
Thank you, Mr. Chairman, and thank you to the Massey Commission for all the great work you've done so far. As you recall, I made a presentation to the commission back a few months ago encouraging the commission to adopt a resolution in favor of enacting recall for our county sheriff. You guys did pass such a resolution, and then I and other county board members brought that resolution to the county board for passage to enact recall. And we had a vote on that back in fact, Commissioner Christian made an eloquent speech to the county board in support of that. The county board, as you know, on a party line vote, voted it down. The Republicans claimed that we didn't have the legal authority under the state constitution to enact recall, even though there is an appellate court decision stating or holding that we do have the right to enact recall. So to resolve that problem, Senator Turner introduced a bill to create a law that would specifically state that counties have the authority to enact recall for countywide elected officials. That was Senate Bill 1954. The bill, even though there's a tremendous bias against recall in the legislature, Senator Turner was very excellent senator. She was able to get that bill out of the Senate. It passed the Senate, went to the House, it stalled in the House. The legislature adjourned at the end of May, and that bill did not become law. So there's another way to get recall on the ballot, as I think I may have mentioned, and that's through initiative petition. And we have the petitions that are already circulating, and we have to get about 8,000 signatures 90 days either before the March primary election or 90 days before the November 26th general election. So I'd like to ask the Massey Commission to endorse the petition drive put the petition on your website with instructions on how to gather signatures, and I'd be happy to work with your staff to get the instructions on there correctly. And I have the petition here tonight if anyone wants to sign it, or anyone wants a blank petition to circulate petitions. We need about 8,000 good signatures to get this on the ballot, either in the March 26th primary or in the November 26th general election. So, and I'd be happy to answer any questions. All right.
Okay, I don't think we'll have any
Okay.
questions, but thank you for the
All right.
information, and
Thank
we
you,
will
Mr.
duly
Chairman.
noted, and we appreciate that. So Ken, I see you're back. If it's your turn, Ken Pasha.
I want to thank everybody who texted me to remind me I was up. I appreciate it. I didn't expect everybody to go so fast, or maybe I was just out there that long. I do want to speak on a couple things, like youth spaces is a conversation I've been having with a lot of people in the last couple weeks, especially with summertime coming. And I think it's really interesting how little there is for young people to do. Like growing up, I had a couple spaces that very quickly got shut down over time by the police and by the community, because a lot of people feel really uncomfortable when they see young people gathered just in a space. They're like, what are they doing over there? And I think it's that sort of level of suspicion that's sort of problematic. And then when you get into like the idea of block parties and SPD using those as an excuse, where else are they supposed to go? There is nowhere to go. Like if you had a teenager and they go, Mom, where can I go tonight on a summer Saturday night and be safe? How long's that list? Yeah. And it's preposterous in a city our size that teenagers have no safe place to go, besides like what, a mall? Would you call our mall safe? Okay, so I guess it's just confusing to me because we continue to have these kind of issues. Like just with our first presenters, did a great job noting that there is very little youth addiction specialist treatment or anything like that. And yet we wonder why we have so many, and I hate to use the phrasing, but like broken adults. People who, like myself, worked their way through the system. I went to rehab for youth. I've been to mental health counseling. I've been on outward expansion, like those youth camps they send you into the wilderness for 30 days. I've been to all that stuff. That's not what did it for me. And I think that's what's confusing, is a lot of times we have these programs and these expectations for young people, but we don't actually ask them what they need. I mean, think about that. Like when you consider the idea that you have all these young people that are going out into the world with their graduation and all these resources in our county, and yet when I ask them if they know about these things, they don't. Because the outreach towards young people, we spend so much time on adults, but we don't consider the idea that like these adults got here somehow. And I'm gonna kind of wrap that back around to the traffic numbers. If you guys ever want a good laugh, go look up my traffic record. It is 10 pages long. It is bonkers. I've literally had them ask me how I have a license, because the kind of units he used to run used to stop me on an average of about 5 times a month through all my teen years, 16 to about 28. I've been pulled over more times than most people can even count. I've watched my car get searched probably 20, 30, 40 times. And it's not an exaggeration. Go look it up, Kenneth Pasha. You can go find my traffic record for free. It's out there. And that's just the stuff they got me on tickets for. That's not all the stops they just stopped me for. Where are you going? Where are you headed? Where you been? Who are you with? What are you doing? It's harassment. And I'm white, so like when you think to yourself, like if I have that experience, and it's all documented for me, imagine being a young black male on the east side of Springfield with those traffic numbers. And I think that's what's confusing, is that I am 43 years old. Don't do the math for when I was 16, but consider the idea that that hasn't changed much since then in terms of the experience. And it's frustrating because we've had how many police chiefs, how many sheriffs, how many things that we've sat down and talked with them, and yet they still do the same things. And it's really frustrating because like you are now gonna see a growth of technology here in town, partly thanks to what has been done on this commission in the county and SPD with the real-time info center, if anyone's aware of that. It's gonna be an actual data center for our Sangamon County Sheriff's Department, Springfield Police, 911, 988, the 708 Mental Health Committee. That's how they're actually going to be able to distribute all that stuff. But that kind of thing also leads to a surveillance state where they use most of that information to do what? I think we all know. It's not going to be a bunch of cameras on the west side pulling people over. I think we all know those mics they've planted everywhere for ShotSpotter don't have a whole dearth of them out there, now do they? And I think that's the question we have to ask ourselves. If we take away youth spaces, if we don't have programs, if our police spend all their time harassing the youth, what kind of adults are you producing? The kind of adults that are scared to interact with the police, which leads me to use my last 20 seconds to talk about the kind of interactions you have with the police, even as adults. At our incredible Juneteenth celebration, one of our SPD officers manhandled a 12-year-old and then proceeded to scream at community leaders, such as the leader of the Juneteenth Festival, a local alderman, and the head of the Springfield School Board, 186 School Board. That's the kind of behavior we still see from our police department on a regular basis. And I think it's just frustrating that no matter how much work we do and we sit down with them, in the end results, the tactics are the same, the statistics end the same. So we have to ask ourselves, is it a lack of commitment on our part or a lack of commitment on theirs? Because we've had a Citizens Advisory Committee, and I'm sure Sunshine could regale us all with details of their lack of intent, lack of follow-through, lack of actual hard data that they take and turn into real changes that lead to different outcomes, because they don't want to sit in these spaces with us. They don't actually care what those numbers have to say, because disparately, that's where the crime is what they'll say. That's where the ShotSpotter tells us to go. And it's frustrating because it's confusing, because I don't understand how it continues to be that way over and over and over again if generations have spent telling them that. Because at that point, it's either that the data doesn't make sense to them or they're just not listening in the end. And I guess that's just the hard part for me, is all these years later, it's still the same outcomes. So I just encourage you guys to really think about that when we talk about, and I'm not pointing this out to you, but I had somebody talk to me about how I talk to Chief Beal and how I'll talk to the sheriffs and stuff, because even though I'm a very non-pro law enforcement person, those conversations have to happen. Even if they don't listen to us in the end, we have to be willing to sit down with them if they're willing to have those conversations with us. And I'm not gonna get into the problems we've had having those conversations with leaders here in this town, but if they are, I do wanna take this very last time, because I know I'm way over time. Wednesday, here in town, the SPD is having an open house. Chief Beal will be there from 5:30 to 6:30 to meet with the public or anyone that wants to come out and question him. He has actually asked me to encourage people to do that, and that's rare. Most police chiefs are not like, come on out. I'd love to talk to everyone. He's specifically spoken to people like me and others to do that. So I encourage everyone in the community to take him up on his word. Come talk to Chief Beal, because otherwise, what do we expect from them? If we don't challenge them and hold them accountable and give them those uncomfortable questions and give them a chance to either answer it or walk away and shut down, then what are we really doing?
Yep. Thank you.
Yep.
Next, Vinny Gupta.
Several states and cities have enacted laws or policies prohibiting police from initiating traffic stops for minor auto equipment or driving violations, often known as pretextual stops. They aim to reduce racial profiling and refocus police efforts on genuine safety threats. And Springfield Police Department should do the same. And there's some examples from different states. California, officers must state the true reason for a stop before questioning drivers, curbing pretextual traffic stops. Then another law prohibits traffic stops solely for expired registration stickers that are less than 2 months past due. Then one law will bar police from stopping vehicles for low-level infractions like expired plates or a single broken light, unless there is another reason with citation mailed instead. Then in the Virginia, new law prohibits stops for defective brake lights, excessive tinted windows, objects hanging from the mirror, mild registration lapses, or loud exhaust, even though those remain violations. Then another law prohibits in Oregon, police cannot pull drivers over solely for minor infractions like lighting or registration vehicles. Then Philadelphia ban stops police for minor infractions, broken tail light, expired tags, less than 2 months old, mirror obstructions, minor bumper damage, unless paired with other offense. Then another law in San Francisco prohibits stops for minor equipment violations unless they significantly interfere with public safety. Berkeley shifts minor traffic enforcement to civilians in its transportation department, removing police from low-level stops. Los Angeles discourages stopping drivers for minor equipment violations like broken tail lights or cracked windshields unless there is a suspicion of serious crime. Then another initiative proposes using unarmed civilian agents instead of police for minor traffic violations. Denver police no longer stops vehicles for low-level infractions that don't pose immediate threat to public safety, such as expired tabs or broken lights per new department guidelines. Then Brooklyn police prohibits police from to stop arrests or searches or stops for non-moving traffic violations, infractions unless required by law. Minneapolis bars stops for things like missing plate lights or minor window obstructions. Officers issue repair vouchers instead. Fayetteville implementing policies removing minor traffic stops and shifting enforcement to non-criminal violations. Seattle City Inspector General recommended in ending stops for minor infractions like expired tags to focus on DUI and reckless driving. Memphis passed law similar to Philadelphia, limiting stops for minor equipment. And so Springfield Police Department should do the same. And I want to thank ACLU and Ken and Edwin and Massey Commission for doing all that you do. Thank you.
Thank you very much. Lisa Johnson. There she is.
Hi.
Hello.
Thank you. You all know how I feel about police, but I always end up having something to say because I am a sociologist. You just can't study sociology without having to come across them. So I would like to point out something. When we're talking about traffic stops between the city and the county, they are two different entities. However, many people feel the same way about both.
Mm-hmm.
And so I'll take an instance from the Springfield Police to address Brianna's question earlier about what suggestions should possibly be made for instilling trust between communities and police, because the police have been wanting to do that themselves. They just haven't wanted to change. So the example that I will use is a $3 million grant that the city of Springfield received from the state of Illinois. The grant was applied for during the last year of Mayor Langfelder's term. The $3 million grant included surveillance equipment for the police. It included about $265,000, I think, for nonprofit organizations who were dealing with youth. and it included a dollhouse program, which a police officer was in charge of, and then it also included this Lights Out program, which under the grant, it was named something else. I said that they applied for this grant during Langfelder's last year of his term. That grant has had to be extended 3 times, not because they didn't get the police surveillance stuff, equipment, but because they were stalling on all of the community involvement pieces of that grant. Better Life, Better Living had to beg and beg and beg because their part, and 1 in a Million, because their part of the grant was reimbursable only. Now, for Black nonprofit organizations that are community organizations that are dealing with the youth that other people don't have the programs for, you're asking them to spend $265,000 out of their own pockets and then get reimbursed for it. And this is what came up in the Economic Disparities work group meeting. Then when they submit whatever they can spend, it takes months to get that reimbursement back. Now you're talking about what we can do for the community to trust the police. They're not trying to instill trust. Do you understand? And so this is where my lack of trust comes from. This is where my dislike of police. I'm not ever giving up on that because every city that I go to, it's the same thing. Their priorities are on criminalizing Black people, not in developing relationships with Black and brown people, okay? They were supposed to have another program that was a part of the same $3 million grant that was giving Ring doorbells to people in the community. And Alderman Gregory had to, go back and look at these tapes, he and Alderman Williams had to go over and over and over and over again asking the chief of police, when are we gonna get our Ring doorbells? When are we gonna get our Lights Out program? When the ACLU, and this is the only meeting that I was in with the ACLU and the police after the first Springfield traffic data came up, Ken had that suggestion at that first meeting after the Springfield traffic stop data came up. And Chief Scarlett's idea was, well, why don't you help us with that? He was not forthright with Ken that he already had the money to do the program. He was still trying to get buy-in from Black people to stand with him to be his little token so that he could release it and then get trust. That is not the way you build trust, and the community already knows it. So unless they prioritize community conversations over community surveillance, they won't get the trust of the community.
Thank you. Okay, Lisa was the last speaker, so this completes our meeting. Our next meeting will be Monday, July 18th, right here again at the Salvation Army. Keep up with the website for more information about this meeting, about some of the great suggestions we've had tonight, and the work group sessions that will be scheduled. And I think, Susan, you've got a comment.
I did, and if it's out of order, I'll save it. Kathy Schwartz wasn't able to be here tonight, but asked me to convey a message.
That's fine. Go ahead.
Okay. So Kathy Schwartz has been working with a local group addressing the food desert that
Yes.
we have on the east side. And there is a group called Rooted in Springfield. It's a collaboration of a group of people. They have an advisory board formed, and they've applied for their 501c3. And they are working with the east side alderpersons on a location, and are working with the community gardens and the Illinois Food Bank to help put those pieces together, and are also exploring options related to a commercial kitchen. And I'm not sure I understand her message. Either CAP 1908 has a commercial kitchen or is planning one, so maybe that comes out of the plan, but she wanted, for the health and well-being of the community, Kathy Schwartz wanted us to know that there's a group of people working on that.
Thank you. Is there a motion for adjournment?
So moved.
By Joanne and second by Sunshine. All in favor, aye. Motion carries. Okay.
So we're back here next month?
There was a lot of stuff there tonight. Oh, boy, Susan was right. She did that math exactly right. Look,
I cannot
had
read
figured
the
it out.
screen.
Look,
It's
17.3
it
is 68. She came up with 80. She's very close. And I'm a trained epidemiologist and statistician. You know, she's right. She, I think she had a pencil and paper too, as a matter of fact.
Explain my absence. My wife was in the hospital. I was in the hospital in May.
Oh my gosh, how you doing?